Good afternoon, everybody. I'm George Kapetanakis. I'm the president of the Hellenic Cancer Federation, ELLOK, which is a patient-led umbrella organization representing 50 cancer patient associations all over Greece. First of all, I would like to thank OncoDaily and the organizing committee for the invitation to participate in this event and the opportunity to share with you the cancer patient's perspective on a topic of critical importance, how to optimize our fight against colorectal cancer, which is one of the most preventable cancers if detected early, yet it remains a leading cause of cancer-related deaths worldwide. So patient organizations play a vital role in addressing this challenge, and today we'll explore their contributions as well as the gaps and the best practices we must address collectively. To understand the impact of the colorectal cancer, let's have an outlook of the current landscape. So it is the third most common cancer and second leading cause of cancer deaths worldwide. Prevention is the key, with evidence showing that regular screenings reduce mortality rates up to 50%. Despite these facts, participation in screening programs remains uneven globally and across Europe, underscoring the need for strong awareness and advocacy efforts. To better understand why there is not sufficient participation to screening programs, we have to acknowledge that the stigma around colorectal cancer is a key factor. Colorectal cancer is considered a taboo in many cultures, as it has a very big and often permanent impact on the patients' lives and their families, affecting their social, professional, and personal life in a way that is not easy to handle. Reducing stigma is the first step, and to achieve it, we have to inform the population about the value of early detection and the modern therapeutic approaches that can effectively cure the disease. On the other hand, colonoscopy, although we really understand it is the best way to early detect cancer, it is not a pleasant process leading to postponements and cancellation of medical appointments. So, what are the barriers in access to screening? The stigma of colorectal cancer, as mentioned earlier, is the bigger barrier in this process, alongside with inefficient information and cultural approaches. The lower financial level population traditionally do not participate to screening programs, as they often are followed by out-of-pocket costs due to limited capacity of public health sector to respond to their needs and the lack of continuity of the screening process after having the findings. Moreover, marginalized and underserved populations, other minorities and immigrants need a special approach that will manage to pass the message and support their participation in colorectal screening programs. Moreover, the population in rural areas and islands often lack access to relative information and screening programs such as the colorectal, often because of limited diagnostic infrastructures. And in addition, we often identify in several areas lack of specialists for colonoscopies. But the most important in my perspective is that the governmental practices to launch screening programs without consulting and collaborating with the patients' associations and the scientific organizations leads to misimplementation and not efficient outcomes. The patient's experience is invaluable. The health policymakers have to harness it in designing, implementing, and evaluating colorectal screening programs. Now, how can we change this culture? First of all, we have to focus in the population health literacy. The governments have to invest in educating the people on how to behave regarding the management of their health. We often talk about patients' health literacy, but this is different. We must invest in the development of a culture that supports our well-being and keeping us healthy. public health and prevention must be part of our daily routine and life and not something extraordinary. Lifestyle is another field that has a significant impact on colorectal cancer incidence. Promoting wealthy dietaries, sports, taking action against obesity, tobacco, and alcohol must be parts of a national plan to endorse public health. Nutrition and lifestyle campaigns are necessary to promote exercise and healthy diet. And taxation policies such as sin taxes to reduce the key risk factors for colorectal cancer has successfully implemented in some countries like Finland, and I believe that we have to integrate them in our agenda for the future. So to ensure the care continuum in colorectal cancer, I believe that we have to invest in 3 pillars: the timely access to best treatments, the psychological support, and the survivorship. So, timely access to best treatments. To achieve this, we have to invest in implementation of fast-track pathways that ensure quicker access to specialists. We also have as patient advocates to partner with policymakers to reduce bureaucracy and increase efficiency in treatment pathways. Moreover, cross-border healthcare initiatives like those promoted by European Union enable patients to access treatments in neighboring countries when local options are unavailable. The same practice has to be implemented within the countries to connect in a structured way centers of excellence and specialists with regional hospitals and practitioners. Moreover, we can promote awareness of clinical trial opportunities for patients who may not have access to standardized therapy and advocate for a wider standardized procedure between countries to ensure patients' participation. And then advocate for timely approvals and reimbursement of innovative treatments is essential. Patient organizations must collaborate with governments and the industry to prioritize funding for effective evidence-based treatment approaches. Psychosocial support. Why it matters? Colorectal cancer does not only impact physical health, it profoundly affects the emotional, mental, and social well-being of patients and their families. Common psychosocial challenges include emotional distress, meaning anxiety and depression, which are prevalent due to the life-threatening nature of cancer and its demanding treatments. The need to integrate dedicated psycho-oncology teams to address mental health is crucial. As cancer patient advocates, we have to work for the inclusion of mental health services in standardized cancer care. Of course, as we said earlier, stigma and isolation. And of course, we have to highlight the impact on families. Caregivers frequently experience emotional and financial stress, highlighting the need for family-centered support programs. Application in virtual support groups enable patients and caregivers to access counseling and share experiences, especially in remote areas. Well, survivorship is a critical phase of cancer journey and often is underserved. We could identify 3 categories that survivorship programs must focus on. First is physical rehabilitation. Long-term side effects such as fatigue, bowel dysfunction, or neuropathy may impact daily life. Patients often lack access to physiotherapy or rehabilitation programs tailored to their needs. We must advocate for individualized follow-up care and resources allocation for managing late effects. Moreover, we can work on survivorship medical programs. For example, a survivorship clinic was established 1 year ago in a university hospital in Greece, supporting post-treatment cancer patients to handle their special physical and emotional needs, and the results are excellent. Emotional and psychological recovery. Patients may experience fear of cancer recurrence, depression, or difficulty adjusting to new normality, so they need to be trained and supported. And of course, returning to work can be challenging due to remaining health issues or discriminations. We must advocate for policies that protect cancer survivors' life rights in the workplace, such as flexible hours and anti-discrimination laws, and the development of support programs such as the ones that are implemented for the maternity. Although governments often establish screening programs and campaigns, the results are poor as the response of the population isn't satisfied, especially the screening for the early detection of the colorectal cancer is more complicated and far from the population's habits and culture. Even the new self-testing methods, which are just a way to indicate the need for a typical colonoscopy, is not very welcome, and the participation of the people is significantly low. Patient organizations, as the representatives of the civil society, are uniquely positioned to address challenges in the colorectal cancer care pathway, from the screening, the early detection, the survivorship, and rehabilitation. They support the equality of life. Patients' organizations are the missing link in a vision for a world without colorectal cancer. Patient organizations must lead the charge in bridging the gap in public awareness, advocating for universal screening access, fostering collaboration across sectors, supporting innovation in cancer care, and empowering patients. So, by ending my presentation, I would like to make a call to action for policymakers to invest in creating equitable pathways to timely treatments and integrate psychosocial care into cancer care systems, develop national survivorship frameworks that address physical rehabilitation and social reintegration. For the healthcare providers, implement multidisciplinary approaches that include psychosocial professionals in cancer care teams. Establish survivorship clinics to provide long-term follow-up and support tailored to the individual ones. And of course, for patient organizations, expand your roles as advocates, connectors, and educators to ensure every patient has access to timely treatments, psychosocial support, and resources for survivorship. You have to lead for awareness campaigns about the importance of addressing a holistic needs of colorectal cancer patients. And by saying that, I want to thank you, all of you, for your attendance, and I want to stress that we have to work together, to collaborate, to develop synergies if we want to effectively tackle colorectal cancer and support the patients in this journey. Thank you very much again.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.